My name is Franz Schmidjell, and I'm in charge of the Africa Policy Desk at the VIDC. As we have a lot of international guests, just a brief information about the VIDC. It was founded in the 1960s by prominent politicians from Europe and from the newly independent states in the global south, especially on the African continent and India, as a kind of think tank for global development issues. Today, the VIDC is a think and do tank in the fields of global policy dialogue, cultural diversity, and sports against discrimination. Just 2 organizational remarks. The event will be recorded, and there's also a live stream on Facebook. Welcome also to our guests on Facebook. And I would like to ask all people except the speakers to mute their microphones. What are the objectives for this event? First, I would say, is to deepen our understanding of the COVID-19 pandemic in the African regions and to learn more about, I have to say, the very quick response by African institutions, especially the African Center for Disease Control and Prevention, which is in charge for a continent-wide coordination. And I have to admit, has done a better job than we have done in the European Union, at least at the beginning. Second, we would like to reflect possible risk. There are many, but we focus on one. That's the limitations in the access to medicine and future vaccines for many people, especially in the global south, due to the intellectual property rights restrictions and profit interests by pharmaceutical companies. And third, maybe to have a discussion or to have some recommendations for policymakers that we are not repeating the mistakes from 20 years ago when HIV patients waited for treatment, but the affordable generics were confiscated in some cases on the airports. So that's more or less the objectives. But now I would like to hand over to our moderator. It's Mrs. Rita Isiba. She's a communication expert and initiator of the Frontier of Dialogues Forum, a platform who promotes the engagement between Africa and Europe. And before, she worked in various UN agencies and financial institutions, especially in West Africa. Thank you, Rita, for your moderation. It's now your turn, and I wish you an instructive, and informative, and inspiring debate. Thank you very much. Rita, your mic.
Thank you very much for the introduction. I wanted to talk a little bit about the Vienna Institute for International Dialogue and Cooperation in Austria. And what I appreciate about this institution is that they have a very strong Africa focus. Almost every single month, there is some sort of event or initiative to help improve our understanding in what we can do, the civil society or other stakeholders, what we can do in order to foster a global partnership. So I do appreciate this initiative, should I say an advocative initiative, in order to gain a bit better understanding in what's happening right now, advent to the COVID-19. So as Franz has mentioned just earlier, our mission for this meaningful conversation is to help improve your understanding of how the financial interest of the pharmaceutical industry and its stakeholders can be viewed as a threat to public health in low-income countries. When I say low-income countries, of course, we're focusing on Africa right now, but I believe this applies to many countries that are right now still in developing stage. So in the next, let's say, 80 minutes, we will try and have this conversation as interactive and informative as possible. And so I'd like to weave in your thoughts during this discussion with our invited experts today. What I mean by that is that you have a chance to share your questions and ideas, and we encourage you to use the chat option of the device that you're using. So whether you are right now watching this from Facebook or you're watching this from Zoom, please feel free to ask the questions using the chat option, and I will pick some of your statements or your questions as we go along. And if we do have some time towards the Q&A session, I may even ask some of you to pose your question virtually in person as well. So rather than me reading out the question, you could just go for it and ask a selected expert or all the experts something that, you know, is bothering you perhaps. So digging right into the topic, you know, we are aware there's relatively low cases of the coronavirus infection registered in different African countries right now, to a point where some people are suspicious and are asking the question, who are the Africans who are actually dying of COVID-19? Are the infection rates actually accurate? So we're continuously bombarded by different types of misinformation, and this applies to all parts of the world. I can give an example of just last evening. I received a WhatsApp message from a friend working at as a civil servant in an international organization in Italy. And the message urged to be aware of pharmaceutical companies strategically planting the coronavirus in order to generate more profit by selling a Korean vaccination. It's just one of those typical misinformation or should I say conspiracy theories that are circulating the internet right now at the moment. The thing is that it perhaps sounds reasonable, but the fact is that vaccines and potential active substances to cure symptoms of the coronavirus will cost a fortune. The market price of a cure is out of reach for people in many countries where the incomes are very low. So in fact, stiff intellectual property rules prevent copying and selling of medicine with the same ingredients for a lower price. So the question is, whose interest is it to secure access to affordable medicine for all? So our discussion today features three distinguished experts who can help us clarify the current situation of the pandemic in the global south. So what I will do now is I may ask our experts to state their name and which organizations they're here to represent, starting with Dr. Raji Tajudeen.
Thank you so much, Rita. My name is Raji Tajudeen Mohammed. I work for the African Union Commission. Specifically, I work for the Africa CDC, the Division of Public Health Institute and Research. And as far as COVID-19 is concerned, I oversee the case management technical working group. I'm a co-chair there. And it's so far so good as far as the COVID-19 is concerned. We've been able to respond collectively as a continent. So it's a pleasure to be part of this forum today and to share with you exactly what we are doing. Over. Thank you, Rita.
Thank you, Dr. Tajudeen. I'd like to ask Mr. Kiiza, Mr. Africa Kiiza, to introduce himself.
Thank you so much, Rita and Franz, for organizing this. Everyone online, hello. Greetings from Uganda. My name is Africa Kiiza. I work with SEATINI Uganda. We are a Pan-African NGO that works on issues of trade, investment, and fiscal policies. We do research, advocacy, but also engage on the official negotiation team of Uganda when it comes to trade, investment, and fiscal negotiations at both levels. Thank you, Rita. Over to you.
Thank you very much, Mr. Kiiza. Dr. Markus Bachmann, would you like to introduce yourself, please?
Thank you very much, Rita, and thank you, fellow panelists. My name is Markus Bachmann.
We can't hear you right now at the moment.
Turned off?
Yes, but we heard your name.
Okay. I'm working for Doctors Without Borders. It turns off automatically.
But we can hear you. Mm-hmm.
Okay. And I work in very various humanitarian contexts, very often in epidemic contexts. Most recently, 5 times in Ebola context in Western Africa and in Congo DRC in the 9th and 10th Ebola outbreak. And I'm really looking forward to our debate this afternoon.
Thank you very much, Dr. Bachmann. So let's just dive straight into our dialogue. I understand that Dr. Tajudeen has a presentation for us. We're eager to learn more about the Africa CDC, how they're responding to the COVID-19 pandemic. Before you start, Dr. Tajudeen, I just wanted to mention thank you again to you, Dr. Kiiza, for jumping into the last minute, because we was also expecting Jane Nalunga, but we understand she wasn't able to make it. So we do really appreciate you jumping in the last moment. Thank you very much. So thank you. So now the screen is yours, Dr. Tajudeen.
Thank you so much. So may I share my slide?
Please, go for it.
Thank you.
So we can see now, it's just about to start now.
Okay.
So we're looking forward to hearing what the CDC is actually doing and learning about the organization as well, because in this part of the world, there's so many organizations we're not aware of that are actively on ground in Africa, working against pandemics and disease control. So it'd be very good to hear.
So, it's screen sharing. I'm having some challenge here with regards to sharing my screen.
Okay. Okay. Would you like to coordinate this with my colleague Franz?
Okay.
You can just close the screen for now, and you can work it out with Franz in what to do. What I will do in the meanwhile is just simply ask Africa a question. Is that okay with you?
Fine by me. Yeah? While I try to sort out the screen.
So while we sort this out. So, you know, there's numerous countries across the African region who is working towards the development of low-cost COVID-19 vaccinations. But as I mentioned earlier in the introduction, there is a number of institutions, international governmental organizations that are against the idea of African scientists developing a low-price generic medicine. What recommendations can you put forward to the likes of the World Trade Organization or the World Intellectual Property Organization? Perhaps you can give me some clarification.
Thank you so much, Rita. That's an interesting question. One of the issues we need to understand and which we as SEATINI subscribe to is that everything is tradable. Everything is in the marketplace. In social services like health have gone on the market, have been put to the marketplace. And while everything is tradable, we also subscribe as SEATINI to the fact that trade is war. We have different countries waging wars. These are not wars of weapons, but wars of different acts, like now let's talk about IP wars. You find that the person who controls the intellectual property of who controls the patent of a certain medicine, of a certain invention, is benefiting a lot, is making a killing, you know, from from an epidemic, for a pandemic, for example, like COVID-19. So the WTO, since its inception, there have been wars, there have been tensions between African countries, or least developed countries, and developed countries on how do we have flexibilities to allow for trips, for trips flexibilities, to allow African countries, to allow poor countries use the capacity of making generic medicines to access essential life-saving medicines. Now, this has been contested since the Doha round.
But why?
Contested, exactly why? Because of the fact that health has been put in the marketplace and human lives are being traded, not in the actual human life, but rather when it comes to commodities which are important to sustain life, when it comes to medicines, when it comes to PPEs, when it comes to research and development, which is critical in informing health, informing generation of health services. So now, for example, Madagascar has come up with a traditional and more cost-effective research in alternative to Western originating COVID-19 medicines. I agree. It is okay to put it to test. It is okay to contest the efficiency of this traditional medicine, but we should bear in mind the fact that every medicine comes from natural resources like trees and herbs. That's the beginning. Whether every medicine comes from natural, from plants. And Africa is rich in the forest. So to crown all this discussion, what is important? That we need a framework and an environment where countries are supported, both with resources, both human and even technical and finance sometimes, to be able to venture into different ways of looking for alternatives to address to alternative medicines, alternative solutions, alternative technologies, because apart from medicines, we are seeing alternative and cost-effective technologies like ventilators, like PPEs, like face masks and all that. So it is important that we put in place, WTO, World Health Organization, put in place rules that make it efficient, that make it possible for countries like African countries to be able to venture into such R&D when it comes to essential life-saving medicines that can pandemics.
Thank you. I would like to bring in Dr. Bachmann to, can you relate to what Mr. Kiiza just mentioned about the challenges of producing generic medicines in Africa with African resources? Have you come across a situation like that where it would actually work to the benefit of the African population, or in your experience, does anything speak against it?
Thank you very much for this very, very interesting set of questions, not even a one question set of questions. What I need to state, and I just want to refer to a very practical example I encountered in nearly all of my missions when working on the continent. That's the access to another vaccine, which is very, very important and gaining importance, which is pneumococcus vaccine against pneumonia. It is a vaccine which is very, very relevant because the loss of lives due to this pneumococcus pneumonias is increasing. It should be included in the vaccination programs of all the nations on this planet, and it hasn't been included because there's two obstacles. One is the price, which is unaffordable for low-income countries, and many countries are not able to pay the price for the vaccines. But there's also another obstacle I want to address, which goes beyond the intellectual property blockages or limitations we have. And I can only agree with Africa, who states that big pharma is insisting that the property rights, the intellectual property rights, they apply just for like any other economic item for medicines or essential medical items, which is not true and applicable. But the other big limiting factor is the manufacturing capacities. When pneumococcus vaccines were introduced, Gavi, the Global Alliance, opened a big facility to make this type of vaccines accessible for many countries, low-income countries in the global south. And there was a guarantee with a $1 billion down payment to the two big manufacturing companies in order to guarantee sufficient manufacturing capacities and availability of sufficient doses. And I just want to refer to my personal experience, and I want to name the country specifically. It's South Sudan or Central African Republic, where I encountered that we were not able to access sufficient doses to vaccinate the children around us, which is really, really very frustrating because, as we all know, the healthcare systems, the curative healthcare systems, are very limited in their capacities. So even more importantly, you would invest into the prevention. And the best prevention would be the vaccination. And we were blocked because humanitarian organizations like Médecins Sans Frontières has no access to the Gavi pneumococcus prices and pneumococcus vaccines, but we even didn't get the quantities to vaccinate. And I think we will later, when we talk about the challenges related to COVID-19 tools, there is blockages at the level of intellectual property rights and the abuse, the excessive abuse of these rights. And we as Doctors Without Borders have a very clear position. And I can only agree with Africa, stating that all flexibilities enshrined under the TRIPS agreement and Doha declarations need to be resorted to by all governments of this planet. And the other big obstacle is sufficient capacity. And as you can imagine, in the situation of a COVID-19 pandemic, there is massive demand, and supply will be outnumbered by demand. So we also need to address the issue of the manufacturing capacities and the bottlenecks there. And again, the capacity to produce is a very valuable resource in the hands of big pharma, and we need to address the situation. And I will later on make some propositions how to overcome this bottleneck in the manufacturing capacities.
Thank you very much for giving us an insight of your experiences in what could happen if there is no affordable medicines available during an epidemic or a pandemic on ground. I understand that Tajudeen is ready for us. Before, yes?
Just a quick one, just a second.
Yes.
As Tajudeen is coming in. To add on to what Marcus has been saying, also the challenge, also another challenge is finance when it comes to Africa. You will find much of our, even as the Tajudeen is coming up, he will be able to, for example, to tell us how much of internally generated finances go to financing the African Center for Disease Control. Much of our finance comes really, if you look at Africa, for example, 75% of our national health budgets is externally financed. In terms of access to medicines, 75% of Africa is dependent on, medical imports. So one of the other impediments to Africa into exploring with R&D, new medicines, is because of the fact that the financing capacity is already tied. These grants that are coming are already tied into specific areas, into addressing specific areas, majorly curative areas of health. So that is also, unless we gain that economic independence, that financial independence as Africa, and start financing our own health programs and other development projects, then that becomes the challenge into the quest for alternative and sovereign health alternatives and medicines. Thank you, Rita.
So if I understand correctly, you're advocating for African governments to start looking within themselves and allocating enough budget in order to generate medicines themselves, or adhere to the rules that are set by the World Trade Organization. Is that correct? Did I understand it correctly?
Yeah, the former, that we need to, when we went to Marabo, we have the Marabo Declaration, where African governments commit to finance at least 15%, allocate 15% of their national budgets every year to the health sector. None of those countries has to date even made 10%. None countries has made that. So that is not the chance. So we need to implement the declaration and be able to finance our own development priorities, especially health. How do we do that, for example, is looking at budgetary allocations. If you look at African countries, all of them, the security sector, for example, the security takes close to 30% of the national budgets. We can to reallocate some of those resources into the health sector. So that's one way I think we can gain that financial freedom and financial independence. Short of then, we are going to remain tied onto the conditions that are given to us by the international financiers, who usually focus more on curative means of health rather than preventive aspects of health. Thank you.
Thank you very much for your input. I would like to continue with that trail of thought. Please hold on to it. I would now like to welcome Dr. Tajudeen to present to us his experience and tell us what exactly his organization, the CDC, does in order to manage the pandemic right now in Africa. The screen is yours.
All right. Thank you so much, Rita. Let me start first and foremost by thanking the organizers of this important webinar. That's Vienna Institute for International Dialogue and Cooperation. I bring you all greetings from the African Union and by extension, the Africa Center for Disease Control and Prevention. My name again is Raji Tajudeen Mohammed. I head the Public Health Institute and Research Division of the Africa Center for Disease Control and Prevention. And I also co-chair the Continental Task Force on Case Management for COVID-19. As of today, we are all aware that we have more than 8.1 million confirmed cases of COVID-19 globally, more than 450,000 deaths from 208 countries and territories.
Now, can I interrupt you just for a short moment? Would you be able to put on your video?
Yes, let me try that. I hope my bandwidth will not go down.
We'll try. Thank you. If it goes bad,
is that fine?
Yes, very well. Thank you very much. So
okay.
yes, please continue.
All right. Thank you so much. So now, coming down to Africa, as of today, we have over 270,000 cases, which is just around 2% of the global total. And in terms of deaths, we have over 6,700 deaths, again, which is just around 1% of the global total. But interesting to know that more than 40% of our cases have actually recovered. Now, you will agree with me that there were a lot of predictions, there were a lot of modeling at the outset of this epidemic, which later on turned out to be a pandemic. And of course, there were a lot of issues surrounding how Africa will be able to fare as far as this COVID-19 is concerned. It will sweep Africa aside. And then largely because one, less than 50% of our member states actually have access to modern health facilities. That's number one. Two, less than 10%, less than 10% of our GDP is actually spent on healthcare for most of our member states, as against 15% that was agreed upon in Abuja declaration. In terms of workforce, we have less than 2 health workers per 1,000 population, as against the standard of 25, which is, again, it tells us that there is a critical shortage as far as healthcare or health workforce is concerned. And again, this is a continent where we continue to face repeated outbreak of epidemics. As I'm talking to you now, we are dealing with another outbreak of Ebola in DRC. And of course, some other countries are also dealing with things like cholera, things like yellow fever, measles, and so on and so forth. So all this together actually put Africa at huge risk of severe or critical form of COVID-19. So in terms of response, what have we done? So we recognize all these limitations right from outset of this pandemic. So what Africa CDC did first was to convey the member states, share information with them at the technical level, you know. And you all recall that the first case of COVID-19 was reported on the continent on 14th of February. 7 days after that, that's 1 week after that first case was discovered, that was in Egypt, Africa CDC, through the leadership of African Union, convey emergency high-level ministerial meeting so that we can, look at this and see how we respond as a continent. And at that meeting, the outcome of that meeting were, one, there were a lot of emphasis on the need to coordinate our effort as a continent, the need to collaborate, the need to communicate, that sharing of information, and the need to cooperate. And
is that actually happening, this coordination?
Yeah, yes, it's really happening. I'll come to that in a moment.
Okay.
The other thing we also did was to endorse a continental strategy and set up a continental task force that was also approved at that same high-level ministerial meeting on the 22nd of February 2020. And this was a big game changer as we respond to COVID-19 as a continent. Now, let me go into this coordination. It's unfortunate I couldn't share my screen with you. So we have the coordination at the highest level, you know. These are the level of the head of state under the leadership of President Cyril Ramaphosa, who is the current chair of the African Union. And just beneath the head of state, we also have what we call the coordinating ministers, you know. So these are ministers of health, ministers of transport, ministers of trade and industry, ministers of science and technology, you know. So we call them coordinating ministers so that they guide what we do as a continent. And of course, we also had the private sector. They were also brought on board. Then we had the regional economic communities. As we all know, all the 5 regional blocks in Africa are what we call the regional economic communities. So they are all part and parcel of this coordination. And as Africa CDC, within each region, we also have what we call the Africa CDC regional collaborating centers. Again, this further takes whatever response that we are putting out there as close as possible to the member states, you know. So you can see that it's not just a coordination at one central location, it's a coordination that is close as possible to the member states. Now, in terms of strategy, we are approaching this thing from 3 fronts. 1 is prevent transmission, 2, prevent death, then 3, prevent social harms. Then in terms of supporting member states, we realize that yes, quite a lot of our members are quite vulnerable economically. 2, most of them do not have the capacity in terms of be it human resources, facility, be it air system. You know, they say it's not even there, you know. So we recognize this right from outset. So the first thing we started doing before even this COVID-19 was declared a pandemic was to begin to build the capacity of our member states. I'll give you one example. In the aspect of lab, early February, there were only 2 countries in Africa that could test for COVID-19. By the end of February, Africa CDC, with support from partners, we've been able to build the capacity of 48 member states that could test for COVID-19. As I'm talking to you now, for the first time, we have been able to build the capacity of our 12 member states as far as genomic sequencing is concerned, so that we know the exact type of the virus that we are dealing with. And for the first time, the genomic sequence of the first, on the continent was done from the continent. It was not done from outside the continent. Okay. So which, underscored the importance of the capacity building that Africa CDC embarked on right from outset. Before I take a pause, some couple of weeks ago, that's precisely 4 weeks ago, as part of our strategy, Africa CDC rolled out an initiative called Partnership for Accelerated COVID-19 Testing in Africa. You agree with me that people have been saying the reason why Africa is not reporting cases because we do not have the test capacity, that the testing on the continent was quite low. Agreed. At that time, about 4 weeks ago, we had less than 500,000 tests, the whole continent. So today, we are proud to say that we now have over 3.6 million tests on the continent. And this key into our initiative, whereby we set out to conduct 1 million tests in 1 month. And within that 1 month, we conducted close to 2.5 million tests. And to conduct 10 million tests by August. Now we are on 3.6. So we are sure that before August, we will be able to conduct this 10 million tests. Because this will give an idea of exactly what are we dealing with as far as the continent is concerned. Now, to also support this conducting this test, we know that global supply chain is nowhere to go, even if you have your money. So we need to approach procurement strategically. So the head of state with the private sector have been able to put together a pool procurement platform that one will allow us to be able to buy, to be able to support member states with test kits and other medical supplies to get this at a very competitive price. Two, to also be able to get it in large quantity to support our member state. And this pool procurement platform is up and running. We are also matching our initiative with deployment of 1 million health workers, especially for those vulnerable and fragile states. You know? So far, we've deployed some community health workers, we've deployed epidemiologists, we've deployed data managers, we have deployed IPC experts. So allow me to just say one thing about issue of vaccine. We realize that the game changer as far as this COVID-19 is concerned will be availability of vaccine. That's the only thing that can take us out of this this pandemic. So we realize that in terms of research and development, Africa is a bit backward, but that does not mean we should not have access to this vaccine. So what the head of state have decided to do is to come up with a conference, called Africa Leadership Role in COVID-19 Vaccine Development and Access. This conference is going to take place on the 24th and on the 25th of June. So, and this conference will attract the who is who as far as global health is concerned. And the focus of this conference will be on 1, research and development, vaccine research and development. 2, vaccine manufacturing in Africa. Even when that vaccine is eventually discovered, or we eventually arrive at the vaccine, how do we make sure that Africa is not left behind? But more importantly, affordable and equitable access to this vaccine will be discussed at that particular fora. So let me take a pause there and allow feedbacks from colleagues, fellow panelists. Thank you, Rita.
Thank you very much. I've got a question that I will take from one of our listeners. But before I do that, I would like Dr. Bachmann to convene or to disagree to some of the statements that Dr. Tajudeen has made. What are your thoughts? What is your experience on ground relative to what we've just heard on the actions of the Africa CDC?
Thank you very much, Rita, and thank you very much, Dr. Tajudeen, for this very insightful presentation and reflection. Let me start. I couldn't agree more on the priority to increase the testing capacities to get a better understanding of the incidence and the prevalence of COVID-19 on the continent. Totally agreed. I think from the perspective of Médecins Sans Frontières, we keep stressing around the globe that there cannot be any complacency related to COVID-19, even as the onset might be delayed as compared to the modeling for the continent, and also that the spread seems to be slower than expected. And you were referring rightly to the modeling, which kind of created expectations of thresholds and threats for coming up for the continent. I think related to the testing, it's very, very important still to bear in mind the interpretation of the tests and the outcomes of the tests about the representativity of the reported cases relatively to the real number occurring. Still, more than half of the states worldwide and many on the continent have very, very high positivity rates, which means they have to do very few tests to find one COVID positive sample patient. This is an indicator that possibly the sensitivity of the testing strategies is not optimal. And I don't want to point at any country. It could be so many on the continent, but there's countries with high numbers and rapidly increasing numbers of cumulative cases and very, very high positivity rates, which indicates that there's possibly not enough testing. So very, very much in agreement with the priority to increase the testing capacities across the continent. As a medical humanitarian organization, we are mainly healthcare providers. And I want to remind COVID-19, the coronavirus is a novel virus. We keep learning as we go, and we need to keep learning as we keep going. We need to adapt rapidly and quickly and efficiently to scenarios as we go. We did that in the global north, and we need to do that urgently in the global south. And we believe strongly, and we want to contribute as much as we can based on evidence, collecting and analyzing data and making them available for all the scientists worldwide and the scientists on the continent. It's very, very important to develop rapidly a better understanding on risk factors and risk populations. We have developed an understanding of risk factors and populations in the global north. All these risk populations, people living with non-communicable diseases, hypertension, diabetes, obesity, cancer, they apply, of course, to the global south, to the African continent. But there might be additional risk factors. We are very, very concerned. We know very vulnerable populations, like people living with HIV/AIDS, with no or intermittent access to ARVs and antiretroviral medication, people living with tuberculosis or multi-drug resistant tuberculosis, affecting the same, the respiratory system as the coronavirus is doing, malnutrition, or malaria, just to name a few. We need to develop a better understanding how these different pathologies might excessively increase the individual patient's risk to lose his life. I don't want to go maybe in my first intervention very much farther than that. But again, I just want to really stress, in order to reach the two major objectives, to reduce transmission and to reduce death and mortality, we really need to much better understand the determinants of these epidemics, of the spread of the epidemics on the continent, and especially the severity profiles when it comes to severe and critical presentations of this disease on the continent. And let me finish. As we work in so many humanitarian crises, we are very, very concerned about the aggravating factors, the combination of a pandemic in the context of conflict, in the context of forced displacement, massive forced displacement. In the context, as Dr. Tajudeen, you have very well presented other epidemics going on at the same time, like the biggest measles epidemics on record in the Democratic Republic of Congo, 2 Ebola outbreaks at the same time in this country, but very, very many other epidemic outbreaks at the same time. And we must not forget the deficiencies in the capacities of the healthcare system, starting from the surveillance systems to the curative response capacities in the various countries on the continent.
Mm-hmm. Thank you very much, Dr. Bachmann. I appreciate that you've conceded to what Dr. Tajudeen said. If I could also add on to this, what I've just heard now earlier, there's so many different, we're looking at the whole subject very complex. We need more money, we need more coordination, but sometimes we need to look at things very simple. And I just received a question from one of our highly esteemed listeners talking about corona dogs, that there's actually dogs being trained to detect the coronavirus. Is this something that has been considered? Is it viable, Dr. Bachmann, as a medical doctor? Is this something that the CDC would implement, or is it viable to trade and train dogs in order to detect this disease?
I'm aware of efforts to do that, and apparently on some entry and exit points on this planet, there is dogs in use to detect suspect cases of corona. So I think it is feasible, but I think as a strategy to cover, to detect, to identify infections, it would not be sufficient, and it would not be efficient quantitatively to respond to that. So maybe there might be very specific situations where this could be a complement, but I strongly believe that the backbone of the monitoring, the detection of infections can only be based on testing. This is the only efficient enough strategy with the quantitative capacities to cater these needs.
Mm-hmm. So I presume testing is one thing and finding a cure is another. And this brings me now on to the next question that I have. Before I pose...
Rita, can I just intervene quickly?
Please.
Before we move on. Yeah, thank you so much, Rita, and thank you, Marcos, for that that intervention. So I completely agree with you that testing need to be smarter than the way we are doing it now. So, and in this regard, what Africa CDC has done is to work with the WHO Afro to put out there some sort of testing protocol that will guide our member states on how they should do this testing smartly. For instance, we know that what is acceptable as far as our test positivity rate is anything between 5 to 10%. And we know that at the outset, for some member states, we were looking at like 80%, 90%, meaning that the test itself was not targeted, you know, and there is nowhere near what is expected. Today, I'm happy to tell you that with this scaling up of testing to around 3.6, 3.8 million on the continent, our test positivity rate on the average is around 7%. Again, I agree with you, this is unaggregated data. When you disaggregate, we may have some few member states, but I think it's better compared to where we are coming from. And possibly going forward, it can only get better. And we are not just only looking at testing. The PACT initiative seeks to test every suspect case. 2, seeks to trace every contact of a positive case. And 3, seeks to treat every symptomatic cases, especially the moderate, severe, and critical cases. And we are building member state capacity along that line. You also talk of surveillance. So lab and case management are just 2 of 7 different technical working groups that have been put in place by Africa CDC. And this technical working group is actually co-chaired by Africa CDC and our member states. And we have all partners as members of this technical working group. So we have technical working group on infection prevention and control. We have on the lab, we have on case management, we have on surveillance, we have on risk communication and community engagement, because we know that this is very, very key to what we are doing. We also have on knowledge management, which seeks to gather evidence from everywhere on what are we doing that is right. We need to continue to do it. What are we doing that is not correct? We need to stop it. What do we need to modify? So we have a technique that is looking at all this. So as much as possible, I think we've been able to approach this response from a technical point of view, and we've also been able to get the necessary political support. In fact, as I'm talking to you now, the President Ramaphosa of South Africa, who is the chair of African Union, Musa Faki Mama, chair of the commission, and the director of Africa CDC, currently giving a media brief, updating the continent on what is it that we are doing as African Union and Africa CDC in terms of the COVID-19. So this is aimed at carrying everybody along, you know, sharing information so that members know exactly where we are coming from, and where we are going. Thank you. Let me stop here and allow others to share their reflection.
Thank you very much for your input, Dr. Tajudeen. I would also like to encourage our highly esteemed listeners to please continue posing your questions, making your statements. And during this discussion, I'll pick some of the questions as we go along. But I was just wondering one thing. I do understand, going back now to the topic of intellectual property, I do understand that there's been recommendations put forward to the likes of the World Trade Organization, and there's this form of legal agreement that needs to be made in order to create a test or to allow for vaccines or any sort of related medicine to be developed in the global south. I was just wondering if Mr. Kiiza can weigh up on this. Can you give us a bit of an insight about this legal agreement?
Could you come again on the question?
Yes, sure. I will keep it very brief. I do understand in order to, for African countries, or should I say generally the global south, to develop a vaccine or any sort of medication or cure, they would have to have a legal agreement with the World Trade Organization in order to proceed. Can you weigh up on this? Can you elaborate a little bit on this? Can you hear me?
Yes, yes. I think one of the, yes, I can hear. Can you hear me?
Yes. Okay, I think maybe we're having some.
So, Africa's experiences. Can you hear me now? Maybe if I need
Yes, I think you should switch off your video, perhaps.
Okay, sorry about that. Okay.
Because of your broadband.
Okay, thank you. So I'm saying one of the experiences, lessons we need to learn is Africa.
Okay, Africa. I think Africa Kiiza is experiencing some technical difficulties.
Discussions
Sorry, can I stop you there? I think because the quality of the sound is really bad. So if you could, exactly, I think you're doing the right thing. Perhaps Dr. Bachmann or Dr. Tajudeen is aware of this legal agreement that the World Trade Organization demands before a vaccine is being developed in the global south. Is this something that you're familiar with?
Thank you, Rita. With regards to trade related issues and COVID-19 vaccine or other therapeutic candidates, So what Africa CDC is doing, again, through the Ministerial Committee on Trade and Industry, is to allow the newly established African Continental Free Trade Secretariat, to handle this aspect of what needs to go into this vaccine development before issue of access and availability on the continent is concerned. So I wouldn't be able to tell you the details of what the CFTA, the African Continental Free Trade area, is doing in this regard, but we've had series of meeting with them, and the ministers of trade and industry are actually part of the coordinating ministers, that is overseeing the COVID-19 continental response. And I believe they have this covered. And in fact, one of the agenda that will be discussed at the upcoming vaccine conference, that will bring together the president of South Africa, the UNECA executive, that's United Nations Economic Commission for Africa, that will bring all these key holders, Theodros himself, together, is to discuss the issue of access to this vaccine and making sure that whatever impediment that is there need to be addressed right from now before that vaccine is eventually available. Over.
So you're talking about access to medicine that has been developed somewhere else. But I understand that every single country that develops a vaccination, they need to have an agreement, a legal agreement with the World Trade Organization in order to release this, I understand. And this agreement is called an Agreement of Trade-Related Aspects of Intellectual Property Rights. Short, it's called TRIPS.
Yes.
So I'm just wondering, is this something, why is nobody really in the Global South taking this legal agreement serious? Are there any constraints?
No, so what I'm saying here is that the access I'm talking about is not about what has already been developed. The COVID-19 vaccine is not there yet.
Yes.
It's not there yet. So this meeting is all about making sure that when that vaccine is eventually available, affordable and equitable access, will be guaranteed to our member states. That is the whole essence of this meeting that is coming up. And we've been able to bring together every relevant stakeholder as far as that space is concerned to making sure that, yes, this vaccine is readily available to the developing countries, and not relying on just what is going to trickle down after every other key player has gotten hold of the vaccine. Bachmann talked about pneumococcal vaccine. Pneumococcal vaccine only came to Africa like 10 years after developed countries have gotten their access and all. We don't want that to happen, because we know that one of the major things that will change or that will be able to control this pandemic will be this vaccine that we are talking about. So everybody is like strategizing on what is the best approach. I know that in the European Union, they've already placed order for close to 400 million euro worth of vaccines if it does become available. So, and for us as African Union and Africa CDC, what we are doing is to bring our leaders together, come up with a common position, and that will be discussed next week. And this involves all the relevant stakeholders as far as access and access, equity, and the affordability of this vaccine is concerned. And I also know that our African Continental Free Trade Agency is already engaging the WTO on the necessary, pharmaceutical giants, also on this issue of access and affordability as far as the continent is concerned. Over.
Thank you. Africa, I understand you're back online.
Yes, I'm back. Apologies.
No worries at all. I was just talking about the legal agreement, and I just remembered what it's called.
Yes,
it's called TRIPS,
the TRIPS.
The Agreement on Trade-Related Aspects of Intellectual Property and Rights. And Dr. Tajudeen just gave us a little bit of an insight about the possibilities of a discussion on how to access the right vaccinations to the African market. Now, perhaps you can give us a bit more of an idea. What are the constraints about this agreement called TRIPS?
Yeah, thank you so much, Rita. And So apologies, I can't share my video. But I was saying before I left that, before I got off, that we need to understand the politics, the power play in the WTO negotiations. And we can only understand that when we look at the history of TRIPS negotiations, when it came to access to HIV/AIDS related drugs, ARVs. It was a tug of war. It was through numerous negotiations, through numerous refusals by African government and Indian government, that we were able as the LDCs to get an extension of TRIPS flexibilities, where we are able to manufacture our own generic medicines of HIV/AIDS, to be able to manufacture them domestically as African countries, or to be able to work with fellow South countries to manufacture these medicines at affordable costs.
But why was the constraint?
Yes, why? Because of the fact that the owners of patents want to make a killing, want to make profits, in that we have marketized, we have put health into the marketplace, that we are better off making millions out of a pandemic, out of an unfortunate health situation, even when millions and billions of poor countries and poor citizens poor people cannot afford to access these medications. So what is required now at the WTO? If you look at the current discussions that are happening when it comes to COVID-19 related medicines and vaccines, Costa Rica is one of, which is more like a South country, a global South country, is one of the countries that is mooting for voluntary patent pools, where a pool is going to be created for voluntary patents for the manufacturers, for the owners of the patents of COVID vaccines to be able to voluntarily hand them over, register them, and allow countries like African countries and other countries to be able to use the same patent in manufacturing generic medicines. Because back to what Raji was saying, even when a medicine is manufactured in Africa, that won't guarantee accessibility. Accessibility will depend on the rules, on the flexibility of other countries, of other African countries, to be able to manufacture a generic, which is of course not a counterfeit. The problem is that we often confuse generic with counterfeit. So if we are able to have rules that allow countries to be able to do generic medicines like we are doing in the case of HIV/AIDS, ARVs, then that should be the way to go. Short of that, then we are going to end up having a number of vaccines, a number of patents, and limited, like Max was saying, limited access to this essential medicine. So that is important. As we are heading into WTO discussions, this should be on the top of our agenda. Mm-hmm. And this should be pushed by African countries as a whole.
Mm-hmm. Well, yeah. I like the fact that you used this example about Costa Rica, because they've kind of found a loophole, or maybe they're going against the rules, and finding an alternative to make the vaccine as an information open source, if I understand correctly. Dr. Bachmann, Dr. Tajudeen, would you like to weigh on this? Dr. Bachmann, please.
Thank you very much, Rita. Maybe just briefly and start from a very different point. We are in a situation of a pandemic, and in order to stop a pandemic, we need to fight the pandemic globally. If we exclude the Global South in its access to the COVID-19 tools, we inevitably will lose lives, but we will also lose the battle against the pandemic. So it should be a global interest in global collaboration. And this is the main talking line and the main advocacy point of Médecins Sans Frontières. Let me just start that at the global pledging event for the Accelerator Initiative of the WHO, World Health Organization, for COVID-19 tools, there were 4.4 billion US dollars pledged for the research and development of COVID-19 vaccines. This is an enormous amount of money. And one of the shortfalls is that many governments provide these huge amounts to pharmaceutical companies, to startup companies, without any strings attached. It is illogical that you have such a huge public investment, which we absolutely appreciate as Doctors Without Borders, without any strings attached on a public return. And the public return we want to be ensured is a global access. It must be a global public good when we talk about the COVID-19 vaccine, because it's mainly and predominantly funded with taxpayers' monies funded by governments. And we need to ensure a global equitable access, as Dr. Tajudeen has addressed, and we are very much looking forward to the conference, Dr. Tajudeen, of the African Union next week. I think it's a very important initiative that in an unprecedented way, the whole of the continent is basically speaking and will be speaking with one voice. We absolutely support that. And I hope that part of this debate will be enforceable mechanisms for technology sharing, for equitable allocation of a vaccine as soon as it is available, and transparency on all levels. When I talk about the equitable access, it is of utmost priority to define who are the priority groups to have access to. And let me just refer to one point which from my practical experience touches me to the heart of my heart. It's the frontline medical healthcare workers. Dr. Tajudeen has explained how scarce in some of the African Union countries qualified medical healthcare workers are. And we need to do everything to protect them, and we need to do everything to protect their capacities, because they are crucial to save lives. It's very logical that, and I miss this in the debates, that the frontline medical workers worldwide must be a priority, very logical. And then the risk groups. And then we need to look at the time point when we will have a vaccine available, where is the epicenter of the outbreaks? Because what is the predominant objective? It's to prevent excessive loss of lives. So we need to go there. All these criteria could be now defined. They could be set into rules, where globally all the nations could refer to and declare them as binding. And then we need transparency, and I want to close with that, transparency in the agreement between the different stakeholders. We have now very noble initiatives, the Accelerator Initiative of the WHO, the Gavi COVAX facility, in order to beef up manufacturing capacities. We have SEPI involved in pushing forward the research and development and clinical development, clinical studies in the fastest possible ways, which again is very wonderful. But there's a lot of agreements which are not disclosed to the public, although it's publicly funded. Aren't we accountable to the global public? And let me end that we really pledge that the civil society, the civil societies of the Global South must be included in the oversight and governance bodies to define the rules, to oversee and to monitor the allocation of vaccines, and eventually also to make sure, and let me end with that, that the needs of the Global South, of the civil societies, are entered into the design specifications of the vaccine. Why am I mentioning that? I think I do not want to end up a second time with a vaccine which is predominantly to be used in the global south, like the Ebola vaccine, which is a wonderful vaccine. It's safe. It has a great efficacy profile, but it needs to be transported. It needs to be stored at temperatures of -60 to -80 degrees Celsius. Would we have ended up with a vaccine with that specification and stability if we had included the civil societies, the stakeholders of the global south in the first place? And my last intervention I need to share with you, because I see that a lot of efforts are done for the large groups, but sometimes not for the biggest groups at risks. For children, maybe this is not so relevant in COVID-19, but for example, pregnant and lactating women. We need to make sure that vaccines are available which can use this protect these very vulnerable groups, including maybe immunocompromised groups of persons, for example, people living with HIV/AIDS without consistent access to ARVs. Otherwise, we will have an excessive loss of lives. And I think with all this massive investment which is in place, we need now to urgently work on the governance structures, which need to be inclusive. And again, I want to end, and maybe I pass on to you, Dr. Tajudeen. Again, I'm very delighted about the initiative and the upcoming conference event of the African Union with regard to that.
If I could just quickly intervene, thank you very much for that, Dr. Bachmann. What I've heard the most is that you have a plea that also the civil society will be included in the discourse about accessibility to future vaccines. Is this feasible, Dr. Tajudeen?
Yes, thank you again, Rita. The African CDC has long hello, can you hear me?
Yes, we can hear you.
Very good. So the African CDC has long recognized the importance of social sciences in emergency preparedness and response. And from day one, we have actually had a committee that is looking at that space. Now, specific to COVID-19, one of our technical working groups is actually looking at community engagement and risk communication. And in this regard, Africa CDC has partnered with UNDP to make sure that the civil society organization or the faith-based organizations are part and parcel of our response. Now, for the upcoming COVID-19 conference, the very high-level meeting that is coming up next week, one of the sessions there is focused on the community, and the civil society are represented in that particular session, just to hear their view. As I said, the outcome of this particular meeting will define the way we approach the issue of equity and access of this COVID-19 vaccine, as a continent. We are looking at it from the angle of a continent. Bachmann talked about this accelerator in Geneva. We are part and parcel of that discussion. If you remember very well, WHO has appointed 6 envoys, for this COVID-19. And John Nkegason, director of Africa CDC, is actually one of those envoys. So we are also in that space, but we felt being in that space is not enough. We need to respond again in a coordinated, in a collaborated manner as a continent, so that at the end of the day, we are not left with what is trickled down. We need to be part and parcel of the plan right from outset. Let me give you an example. When the issue of test kits became a big problem in terms of availability in the global market, so we were part of this accelerator. We let them know that, look, what you allocated to Africa is nowhere near, is not enough, So we had to push for that as a continent. And of course, everybody listened, and we made our justification, and at the end of the day, at least we got something that was able to, address our need at that time, you know. So, and we believe that the negotiation for this vaccine is not going to be different from what we did for the test. And now, in terms of this vaccine being a global public good, I know that AstraZeneca, as part of their plan, you know, they're already working with a company in India that will make available the generic form, you know, and that company will majorly target the global south, you know, just to make sure that issue of access and equity is fully addressed. In fact, I think in terms of projection, they are looking at about 2 billion or so, copies of that vaccine to be made available to the developing world. Again, this is planned. We don't know what will happen in terms of, in practical terms. But I think as much as possible, approaching this collectively as a continent will give us a better stand in terms of access and equity. Thank you.
This sounds all very optimistic, and it's also good news to hear that India is in the process of creating a generic medicine available for the global south. I understand that Mr. Kiiza also has, who would like to elaborate a little bit more about the free trade agreements apart from the World Trade Organization in order to enable generic medicines. Would you like to elaborate on that?
Oh, sure. Thank you so much, Rita. Yes, one of the issues we have been confronted with as LDCs in the discussions around TRIPS and flexibilities has been the ascendancy of free trade agreements, both at bilateral level, but also regional trade agreements, in terms of the fact that they tend to have what we call TRIPS plus provisions. That is, they tend to have provisions which go beyond rules and aspects that we have agreed to at the WTO. And now that is the challenge. Often we have seen some FTAs, free trade agreements, where African countries end up eroding the flexibilities and the policy space that we fought hard to achieve at the WTO. So this is also something that we need to be critical of, that developed countries, that big national corporations of developed countries continue to fight so hard that they even ensure that the freedoms which LDCs enjoy in the WTO TRIPS flexibilities end up being taken away in FTAs, because FTAs are more power asymmetric. They are power asymmetrical, and they are laden with more of power play, more of bulldozing and stampeding LDCs to conclude, rather than based on a more kind of democratic process than WTO. So that's something we also need to be careful about, that even in Africa, even our continental free trade agreement, unless we ensure that it does not contain TRIPS plus provisions, then we might not be helped. Maybe briefly on what civil society can do. Also, I think CSOs have a very big role to play in complementing the efforts of the CDC, for example, of the African Center for Disease Control, for example, in aspects of supporting research into research and awareness when it comes to COVID-19, both preventive and preventive measures, and also when it comes to recuperation measures on how to engage, how to heal when once good. So that kind of research, both policy research, also, for example, diving into supporting African governments into generating positions in trade agreements which are going to ensure that access to
Mr. Kiiza, the quality of your sound is very unstable. No worries at all. I understand it could be sometimes a little bit challenging with technologies out of our hands. But I've gathered what you've said is that the CSO also has a very great role to play, similar to what Dr. Bachmann pledged as well, particularly also in the prevention measures. And it's clearly the case, because if there would be more coordination between the CSOs and perhaps also the CDC and similar institutions, we won't have another outbreak similar to, for example, the Ebola situation. Now, I would like to take some questions from the audience as well to make sure that this is as interactive as possible. And I've got a question here from a lady named Christa Handover, and she's asking whether we can repeat what the name is of the conference that is happening next week in Africa. What's the name of the conference?
Can you hear me?
Yes, we can hear you very well.
Okay, yes. So I'm going to share the flyer now to everyone on the platform.
Excellent.
It's called Africa's Leadership Role in COVID-19 Vaccine Development and Access.
Mm-hmm. Super, thank you so much.
Yeah, but I will share the flyer right now with colleagues. Yeah,
that will be great. Thank you. Now, the next question that I have here is one from Facebook. Given malnourishment and other problems in many African countries, how can we shut down economy and focus only on a virus when the consequences on life and health now already look even more severe? I think perhaps Dr. Bachmann, would you like to answer this? Because it sounds a little bit more like your domain.
Thank you, Rita. I think we all have seen how COVID-19 has crippled one of the most elaborate and most resourceful healthcare systems in the world, like in northern Italy, like in Belgium, like in Spain. And we can imagine how it can knock on much more fragile healthcare systems in some of the countries on the African continent. And this is the reason why we, as Doctors Without Borders, we invest all our efforts to maintain the healthcare provision of the non-COVID-19 healthcare services. I think it's very, very, very essential in order to avoid an excessive loss of lives when it comes to malnourishment, when it comes to sexual and reproductive health, when it comes to the treatment of chronic diseases and fighting HIV/AIDS, tuberculosis, which has a immense disease burden on the continent. I think this is extremely important to stress that in the context of a epidemic, we must learn from the mistakes. Like in Western Africa during the Ebola outbreak, everything was focalized, verticalized. All the resources were going into combating Ebola, and at the same time talking about sexual and reproductive health. The maternal and neonatal mortality rates were going through the roof, which was really terrible to see and encounter. And we must not replicate this mistake once more.
Mm-hmm. Thank you very much for that. I will take one more question. And this
Rita, can I just say something?
You can always say something. Please go for it, Dr. Tajudeen.
All right. Thank you, Rita. Thank you, Bachmann, for reiterating the need to continue to run our essential health services. We learned a lot from West Africa. 11,300 people also died from the Ebola outbreak in West Africa. But equally, the same number, even much more than that, died from the routine health services. So we need to avoid repetition of that mistake. And in this regard, what Africa CDC has done is to issue a guidance document to member states on what they should do in terms of continuity of essential health services. One, the need for them to have a protocol in place, to guide continuation of essential health services. Two, for them to identify those services that need to run concurrently. And three, for them to come up with how do you do it safely so that in the course of coming for those essential health services, you do not get infected with COVID-19. More importantly, for them to continue to talk about it the same way they are talking about COVID-19, they should use that same platform to continue to inform the community that those routine health services, maternal and child health care, sexual and reproductive health, the TB program, malaria, HIV program, that these programs are still continue. But they need to come up with how would they do it safely in such a way that there won't be COVID-19 infection. Over.
Thank you very much. I would love for us to continue this conversation, but we've literally reached the end of our discussion. I wasn't even able to take more questions. However, in case you missed some parts of this discussion, do not despair, because the VIDC Dream Team will create a report which will be available on the website, but also you can have a chance to access the recording of this discussion on the VIDC YouTube channel. And if this discussion resonated with you, stay tuned for future events brought to you by the Vienna Institute for International Dialogue and Cooperation. Just to point out to you, the next discussion will explore the COVID-19 debt crisis, and it will be held in the same format on June the 24th at 2 p.m. Central European Time. For more details, just go onto the VIDC website or the VIDC Facebook page. And I would like to thank Dr. Raji Tajudeen, Mr. Africa Kiiza, and Dr. Marcus Bachmann very much for taking time of your busy schedule to share some of your knowledge and to decipher what is really happening in Africa at the moment. And the way it sounds is rather more optimistic than dire. Thank you very much to all the listeners for joining us. My name is Rita Isiba. Be safe and auf Wiedersehen.